Case control studies 5 marks. Sharma. In case control studies, causes of a disease are investigated after the occurrence of a disease. For example, a researcher investigates the history of smoking in patients diagnosed with lung cancer. Characteristics of case control study design. The study design uses to exposure and outcome measures that are anchored in measured time. The study begins with the outcome measure and relies on participants' memories or medical records to go back to measure the potential exposure. Unique feature of this design is that individuals with outcome of interest, case, are compared to individuals who do not have the outcome but were risk of it, control, to compare to individuals who do not have the outcome but were risk of it, control, and determine difference in past exposure to the potential cause of the health phenomenon. The unit of analysis in case control studies is the individual, and in this design only one measure of association between exposure and outcome is appropriate, that is odds ratio. This type of design begins with selecting the cases after operationally defining the cases. The operational definition should not be too narrow or too broad because too narrow operations of case may cause it difficult to choose the sufficient size sample in given period, and too broad definition seriously minimizes the validity of the result. Therefore, balance must be ensured in operational definition of cases to avoid the aforementioned problems. In the study design, cases and controls are identified from either clinical or general population sources. The clinical services such as hospitals and medical clinics are convenient sources to obtain cases, but it must be ensured that when cases are taken from hospitals, that control must be identified from same and similar hospital which did have the specific disease manifestations. For example, if cases of lung cancer are selected from hospital, a control treated in hospital for ALS other than cancer should be chosen. However, patients with illness too similar to lung cancer such as emphysema should be avoided as controls due to similar disease etiology. Other previous cross-sectional service for these cases control should be chosen from the same neighborhood, community or region. Friends, relatives and co-workers of cases can also be used as controls. It must be ensured that whenever possible and practical, controls should be similar to cases in important outcome relevant characteristics such as age, gender, occupation, medical history, residence, and so on. Weaknesses of case control study. An inability to calculate incidence or prevalence of the outcome. Incidence is impossible to measure because the study travels back in time. Showcases cannot be measured as they emerge. Similarly, the extent to which the sample represents the population of individuals with the outcome cannot be established because the sample was purposely selected to include a large proportion of cases. Another weaknesses of the case control design is uncertainty about the true temporal order of exposure and outcome due to potential weakness of a very historical data. In addition, the quality of data in the study design data in this study depends on the past memories of study subjects early and sincerity and collecting the data. As per Srivani, case control studies investigate the risk factor for diseases. The story begins with the identification of individuals with disease, case, and without disease, controls. These individuals, cases, and controls are compared for risk factors. Case control studies require less samples compared to cohort studies. Example, in 1992, Chiang et al. Conducted a case control study involving 128 histologically or cytologically confirmed cases of hepatocellular carcinoma and 384 controls without the disease. The study was carried out to assess whether hepatitis B infection played a role in the etiology of primary hepatocellular carcinoma. Of the cases, 77% were carriers of the hepatitis B surface antigen, HBsAg, compared with only 28% of the controls. Advantages. Generates more information from few subjects. Only feasible option where there is a long latent period between the exposure and the disease. Only few subjects are required. Useful for gathering hypotheses that can be tested using other types of designs. Disadvantages. Confounding variables are the major problem in analysis. Subject selection is potential cause for bias.